All right. So I'm going to tell you some amazing facts about the American healthcare system and how much it sucks. And if you don't live inside America, you're going to be shocked by these facts. If you live inside the U.S., you probably don't know most of these, and you'd be shocked at how great the rest of the world's healthcare system is in actually covering people who get sick. So obviously, coronavirus precipitated me looking into this even more. We've shared a lot of this with you before in different stories, but I'm putting it all together here so you have a sense of it. You can share this video with others to give them a sense of how bad off we are and how we need to desperately change the system. So in terms of where we stand today on coronavirus on Saturday, as I record this live, we're almost at 1 million cases in America, almost at 3 million cases worldwide. So America is leading the world in number of cases by a lot. And we've now passed 54,000 deaths in America. So, and now a lot of you know the carnage that coronavirus has done. So that's not as much of a surprise for you. But when I tell you about the rest of the disaster in this country, in terms of healthcare, it is quite shocking. So if you're watching this on YouTube, I just want to tell you, I can see your comments, and especially if you're a Young Turks member, it shows a badge on there that allows me to see that you're a member. If you join in the middle or you use YouTube Super Chat in the middle, I see that as well. I want to get through a lot of stats here, so I'm not going to be able to do a lot of shout outs, but I do see you. And obviously you can just hit the join button right underneath the video to become a member of the Young Turks on YouTube and get our videos. Okay, so fact number one obviously was about coronavirus. I just told you that. Number two, we have 27.5 million people at a minimum uninsured in this country. And that was pre 26.5 million people becoming unemployed. And in America, most of the folks that have insurance, it's tied to their employers. So when they lose their jobs, they also, most of the time, lose their health insurance. So what used to be 27.5 now is going to be a much, much larger. If you don't live inside America and you live in a developed country, you're going to say, what do you mean uninsured? Isn't everybody insured? No, not in America. Well, then if you don't have insurance and you get cancer, what happens? In America, we let you die. Amazing. Like, if you're living in Sweden right now, you're going, no, that can't be true. In Japan, in South Korea, they're like, no, he's exaggerating. He doesn't like the current administration. No. Absolutely. You don't have insurance, especially if you're middle class. If you're poor, you can get Medicaid. If you can go to the emergency room. Hey, you broke your arm. Okay, they'll take care of you. I mean, they will bankrupt you. They will then send you minimum $5,000 bill for if you broke your arm. It's going to be much greater than that. And if 40% of Americans can't survive a $400 emergency. We just had an emergency much, much larger. But they will bankrupt you. But yes, they'll actually put your arm in a cast. If you're shot, they'll take care of you. But if you are middle class and you don't have access to Medicaid, and you chose not to be insured, maybe because you didn't have a job, so it wasn't much of a choice. Maybe it was just too expensive and you couldn't afford it. Again, not much of a choice, but you didn't have one. If you have something that can't be taken care of in an emergency room, we let you die. It's insane. That's the system we have now. 27.5 million people uninsured before coronavirus hit. 60 million have deductibles that are so high that they avoid going to the doctor. So they're what is considered underinsured. There's a lot of different ways to be underinsured, but that's one of the ways. So since 60 million people aren't using their insurance because they're so worried about their deductible. Again, if you live outside the country in a civilized nation, you're like, what do you mean deductible? Well, a lot of our insurance companies, our insurance plans, have very high deductibles so that you can keep the premiums lower. We pay for insurance in many different ways here in America. One, you pay into the insurance system through your employee. Then you have a premium, so those are non-negotiable. And then if you get sick, you have to do co-pays. Oh, you're going to get a checkup from a doctor, you have to pay on top. Yes, on top of your premium. Yes, on top of what you were already paying and what your employer was already paying into the system. And then some folks, in order to keep the premium lower, have a deductible. And some of those deductibles are very high. $3,000 is not an unnormal premium. Sorry, a deductible, I should say. And so that means the first $3,000 you pay. That's why people don't go to the doctor. They're like, well, if I go to the doctor and I do anything in America, it's going to cost me $800 before I know it. I'm throwing out these numbers that are a little random, but anybody who's had experience will go, oh, yeah, you'd be lucky to get out of a doctor's office for $800. And if you got a deductible, you have to pay the whole thing. So when you add in the 60 million that won't go to the doctor because they have premium and 27.5 million uninsured, then that's 87.5 million Americans that don't use the healthcare system. Again, if you're in Canada or Norway, you can't believe it's true, but it is. Fact number 4. Undocumented immigrants in America can't use Medicaid. Not in every state, but in most states. So that means if they're poor, normally the poor can use Medicaid at least. It's some form of insurance, not great, but it's the very bottom of the safety net. It'll catch you right before you die. But if you're undocumented, nope. Now, a lot of Americans, not just right-wingers, but definitely right-wingers, say that's great. If you came into the country illegally, you're an illegal alien. We should give you guys you get it out of the system. Now, of course, what they don't recognize is that undocumented immigrants actually pay more into the system than they get out of it because they pay a lot of taxes like payroll tax and sales tax, and they never get the benefits of Social Security and Medicare because they're undocumented. But in a case like coronavirus, well, if the undocumented immigrant doesn't have Medicaid, he can't get tested, he can't get treated. So guess what? He's going to spread it to other people, who are then going to spread it to other people, who are going to spread it to you. So you were having fun kicking people who were down, like, yeah, that's right, they don't have any Medicaid, and then we're going to let them die in the streets, and you were enjoying that if you're a right-winger. But now, when they spread the virus to you, you're not enjoying it as much, okay? So that's insane. A virus, like a fire, should be dealt with from a public organization, not a private one. If you got a fire, it spreads to other houses. That's why we have public fire departments, not privatized fire insurance. Same should be true of health insurance. Next fact, 25% of workers don't have any paid sick leave in America. That's 33 million people. Again, if you live in a civilized country, you're going to say, well, then what happens if they're sick? Well, then you don't get paid. Really? Like, what if you have a fever? Well, you either show up to work or you get nothing for 33 million Americans. So then you're going to think, well, wait a minute. Then if they're sick with coronavirus and they have no money, they're out of money, which is true for a lot of Americans, then they're going to go into work and infect other people. Exactly. Now you wonder why we have the most cases in the world? Well, number one, we were totally unprepared. We have an absolute clown, a carnival barker as a president. But number two, our system is disastrous. So uninsured can't get tested, can't get treated. That's a ton of people, as I just explained to you. The undocumented immigrants can. If you're sick, you show up to work, infect everyone else anyway. A lot of the workers didn't even get masks or gloves, even at giant organizations like McDonald's. And then they spread it to all the customers. This is insanity. This is the insanity we live in. That's why we have 1/3 of all the cases in the world. That's why it's raging out of control in America, because our healthcare system is itself sick. Okay, and Jeffrey, I saw that you became a member. Again, I can't do shout outs to everybody, and I've seen all the people with the badges. Really appreciate it. If you want to become a member, again, join buttons down below if you're watching on YouTube. Another amazing fact, medical record companies and a lot of providers, including hospitals, fight to make sure that you don't have access to your medical information. I keep going back to this, but if you're in a civilized country, you got to be thinking, come on, Cenk. Now that can't be true. How could you, what do you mean they try to block access? Well, if you try to transfer your medical files from one place to another, they make it very difficult. If you try to pass a law making those records easily accessible to you, it's your records, they send in lobbyists to fight against it. Why? Because those companies are also privatized, and so are the providers. If they make it easy to have access to your own medical records, well, then you could go to another provider. That's why hospitals and other providers fight it. Or you could use other systems to keep track of your medical records. Well, they don't want that. So they want to make it incredibly hard for you to get your own medical records, which then prevents you from being able to treat yourself effectively if you're somewhere else, if you moved, if you just want to go to a different provider. Because everything in America works on bribery. So since those providers and the medical record companies give campaign contributions to our politicians, they then own them. And they pass laws saying, nope, getting your own medical records will be incredibly difficult. Okay, on to amazing fact number 7. 25% of Americans put off treatment for serious medical conditions, not just medical conditions, but serious medical conditions. Why? Same things, high deductibles, and they can't afford it. They don't have it. Spencer, thank you for becoming a member. And so they put it off. Well, then, if you already have a serious medical condition, then you get coronavirus, well, your percentage chance of dying went up dramatically. So, welcome to America. We're number 1. We're nowhere near number 1. Well, the only thing we're number 1 in these days is we're number 1 in coronavirus cases, and we're number 1 in coronavirus deaths. New story out last week. Insurance companies that said, oh, no, don't worry. We're going to cover tests for free. Then they said, you're going to do treatment for free? They're like, oh, no, you're ridiculous. No, if you have coronavirus, you're going to have to pay almost everything you have. You got a high deductible, bankruptcy. We don't care. We're going to take your house. We're going to take everything you have. You live in another country, UK, France. You're thinking they're not going to take your house to treat you for coronavirus. Then you're not going to want to get treatment, and then you're going to spread coronavirus to everyone. Exactly, that's right. So these companies, they say, well, I mean, but we are being merciful because the government made us, and there was a lot of public pressure. So we're providing free tests. Are we not merciful? Not really. That's bare minimum you can do. But they go, just kidding, not free. Next year. And this is the story that came out, they're thinking of increasing premiums, some of the companies, up to 40%. Who the hell can afford their premiums today, let alone if they increase them 40% next year? Well, we had a lot of costs this year, and we had to treat a lot of people who had coronavirus, so we're going to put those costs onto you. Well, we can't afford it. Then we won't have health insurance, then we'll have more coronavirus, and you'll have more costs. Yeah, but I got to make my profits, and the executives got to get paid. I got to make millions upon millions upon millions. In fact, in combination of the CEOs of just health insurance companies, all they are is middlemen. None of the other countries have this. That in the developed world, they might have layered insurance, but they all generally have single payer, and so they don't have these middlemen. These middlemen, just the CEOs combined, make billions of dollars. Poof. Billions of dollars, total and utter waste in other countries. That you have health insurance. It's given to you by the state. There is no middlemen. There are no executives that make billions of dollars. And it's more efficient and it costs less. So, but here, they're going to increase premiums, some of them, 40% next year. Well, what happens if you can't afford it? You can't afford it, sad day, you go die. Okay, that's America. Land of the free. And of course, back to coronavirus, more specifically, Donald Trump cut the pandemic office. Genius move right before the worst pandemic of our lifetimes. Oops. When I say cut it, I don't mean he cut it, the funding for it. Oh, it's off by 10 or 20 bucks or 10 or 20 million. No, eliminated it. We don't need a pandemic office. What's the chances we're going to have a pandemic? Oops. Okay, he also massively cut the budget for CDC, Center for Disease Control. Oops. So 0 for 2. And then when I originally wrote this a couple of days ago, my notes on it, I was going to tell you about how he has reduced funding for the World Health Organization in the most disastrous time. But since then, he's announced that he's cutting funding entirely for the World Health Organization. Oh, they did a good job with the testing. We didn't take their tests. That makes us bitter. We suck at testing here in America. The rest of the world, like South Korea and Germany, doing not the whole rest of the world, but some places, South Korea and Germany, doing fantastic in testing. We're bitter. That's it. We're cutting the funding for World Health Organization. Now you'll all suffer with us. You'll also have terrible health care. Oh my God. And Alexandra, thank you for using YouTube Super Chat. That helps the show a lot. So that's the situation we're in. So he cut it entirely. Do you think that's going to help this situation when we have record number of deaths? No. Okay, but he doesn't care. By the way, why did they do all those drastic cuts during Trump? Because they did a tax cut for the rich. 84% of it went to the top 1%. You know how much the tax cut was? And to the top corporations. It was for $2 trillion. Since they gave away $2 trillion to the people who need it least, by the way, why did that doesn't make any sense. Why give it to the richest people in the country? Because they're donors. They do campaign contributions to the politicians. Poor people don't give any campaign contributions. Middle class, now they give to progressives like Bernie Sanders, AOC, etc. But overall, the rich, in essence, bribe all of our politicians, so all of our politicians work for them, so they give them a $2 trillion tax cut, then they turn around and cut essential health care services in America. We already have private health insurance, so a lot of us aren't covered in the ways that I explained, so that leaves no social safety net and an absolute disaster waiting to happen, and boom, it just happened. Congrats, everybody. So if you still can't see that not having single payer, having Republicans in charge that give away tax cuts for the rich and cut these essential services and don't want even the Affordable Care Act, which is not anywhere near sufficient. They don't even want that. They want to kill that. They want to make it so that if you have a pre-existing condition, this was the old days, and they are in court today, the Republicans and Donald Trump together are in court fighting to say the insurance companies should be allowed to discriminate against you if you have a pre-existing condition and deny you health insurance. Well, you know who has pre-existing condition? Tons and tons of people. Well, those are the people most likely to be sick, so the healthcare insurance companies are like, I don't want to pay for them. I don't want to pay for healthy people, which aren't going to use the service, and I'm going to take their premiums, their co-pays, I'm going to take everything they have, and I'm going to give as little as possible. I don't want to treat sick people. Well, then what's the point of insurance? That doesn't make any sense. And they're like, yeah, I just want to make a profit. Yeah, that's what private companies do. They make profits. Does that help our health? Not at all. This is the insane system that America has. Land of the free. Politicians you're free to purchase politicians. Let's put it that way. The American media, this is why when I ask you to help keep young Turks strong and healthy in these tough times, no one else in mainstream media tells you this, right? We do something that others will not do. And it's amazing that it doesn't exist in America outside of progressives that are online. And most of those progressives are in the TYT network. So that's why tyt.com/go is so important. The rest of the mainstream media, they make it seem like single payer is outrageous when in reality the rest of the world has it. They make it sound like it costs more when in fact it costs less. They make it sound like giant tax cuts for the rich are perfectly normal, but actually giving insurance to American citizens is insane and totally unreasonable. No, of course you should pay for it. If you can't pay for it, you should die. And the rest of the media finds that perfectly normal, and they defend it to the hilt. Now, in a wild, wild coincidence, it turns out that most of the cable news outlets, not most, every one of the cable news outlets has giant amount of advertising from health insurance companies and drug companies that also benefit from the sick system. Wild coincidence. I'm sure it has nothing to do with it. Oh, and why don't they point out the obvious corruption? They will never, ever call a campaign contribution what it obviously is, a legalized bribe. You give somebody $1 million, that's a politician, and they vote with you, that's a bribe! That's a bribe. No one on TV, no one at the New York Times, no one at the Washington Post, no one on NPR, no one in mainstream media will ever say that. Now, another wild, wild coincidence. So much of those campaign contributions go into media ads that you see on TV and the newspapers that make them rich. Wild coincidence, don't mention it. It's very uncouth and impolite to mention it, okay? tyt.com/go. Support us so we can tell you the reality. You can look up everything we say. We are vigilant about getting all the facts right. And then we give you a perspective that it's sad that it's bold because it's so obvious. And it's so sad that we live in a country where it takes courage to say things that are super duper obvious to the average person. All right. Last one here. Over the last 10 years, out-of-pocket spending on healthcare has gone up 58% for people with health insurance. Forget people without health insurance, they're totally screwed. But even if you have health insurance, your out-of-pocket spending in the last 10 years alone went up 58%. How in the world can anybody afford that? Like I told you, 40% of Americans can't survive a $400 emergency. Not a $4,000, not a $40,000, a $400 emergency, which, by the way, we just had one. And so how are you going to afford the premiums nonstop rising? By the way, when we were criticizing the Affordable Care Act, otherwise known as Obamacare, we were criticizing it from the left, and we said the number one problem with it was that it did not have price controls. And without price controls, the insurance companies were going to continue to raise our rates and then blame the government. Guess what happened since then? We were proven 100% right. It's good that the Affordable Care Act covers more people, and now tens of millions of people more have insurance. That's good. The bad side is price is totally out of control, and then they turn around and blame the government, just like we said it. By the way, the establishment, their number one thing that drives them crazy is when we progressives are right, then they get even more angry. And they say, oh yeah, that's it. Then we're never going to let you on TV. And so that's why you see a lot of the clowns that you see on TV, the so-called analysts, pundits, commentators, etc. They're the people paid to be wrong. And they're celebrated for being wrong. Oh, you got the Iraq. Everyone on TV got the Iraq war wrong. Great. Raises for everybody. Those guys who got it right, don't ever let them on TV. Okay. Oh, Medicare for all. You guys were all right about it. Here we are in the middle of a pandemic that shows that we absolutely positively need Medicare for all. The voters, the Democratic voters overwhelmingly want Medicare for all over all the country. Over 50% in every poll, no matter how much it was attacked, want Medicare for all. But the people on TV will tell you, no way, no way. The country doesn't want it. They lie about their own polling. So don't tell me it's a coincidence. Don't tell me they don't mean it. It's intentional. And then there's a conspiracy theorists out there who say, no, the only public corporations, multi-billion-dollar corporations that do not care about profits are media companies. Oh, they don't care about profits at all. Oh, so when their major advertisers are politicians and drug companies and health insurance companies, oh, they couldn't care about that at all. No. They're being on the level and they're being straight with you. And so when they see that, oh my God, the country's crying out for Medicare for all, they accurately report it. Nope. If you watch cable news in the last year in America and you didn't know the polling and you didn't see the exit polls in the elections, primary elections that already happened, you would be convinced that the country despises Medicare for all and that they think it's totally impractical and that nobody wants it. Not true. The majority of Americans in every single poll say that they want Medicare for all. And among Democrats, that number is at 80%. So why didn't they vote for the one guy who was for Medicare for all, Bernie Sanders? That's a logical question. Again, if you don't live in America, that's weird, right? That's because the media told him, oh, Bernie Sanders will definitely lose to Trump. Well, he will lose. He will lose. Biden will win. Biden's great. Biden's the best. Biden will definitely win. Bernie will definitely lose. So people panicked and they're like, oh my God, Bernie has all the things that I want, including Medicare for all that I desperately need because my premiums went up 58% in the last 10 years and I have a high deductible, so I can't ever go to the doctor. But everyone that I trust, when I turn on TV or I read the paper or I turn on the radio, every single one of them told me that Bernie Sanders can't ever win. And the only person who could ever beat Donald Trump is Joe Biden. And I really want to beat Donald Trump. And I don't blame him. We all want to beat Donald Trump. So they voted for Biden, full well knowing that Bernie had the policies they want and Biden did. Now that election is over. I'm just giving you that as context for why we have the broken, sick health care system in America. Because 90% of the politicians are totally bought and paid for, completely corrupt. The media is bought and paid for, and they're corrupt. So they maintain a system that makes no sense at all, that is brutal to its own citizens. And they all are millionaires and think, it's good for us. What do we care about you guys? So our job here at TYT is to tell you the truth. You can look up every one of those facts and you'll see even more depressing facts on there. Our country is literally sick and dying, and none of our politicians are going to do anything about it because we don't live in a democracy. I wish we did, but this is what prevents it in essence and in fact. By the way, if you want to change that, the underlying sickness you have to fix is the corruption. In order to do that, you got to go to Wolfpack. wolf-pack.com/join. So those are the organizations looking out for you guys while the rest of the country finds this disastrous state to be normal, and they report it as such. All right. Much love. See you soon.